Hi, it's Mara here. I am 22 days out of surgery now, and things have been going okay until last Friday when I woke up in the middle of the night with stabbing pain right below my sternum, and then on to my left side, and I didn't know what was going on, and then I was getting ready to call my surgeon, and I thought, well, I should probably take my blood pressure and my pulse rate because I have a machine that does that because I have had high blood pressure for a few years. And my pulse was 131, and my doctor's directions post-surgery were call if your heart rate gets over like 105. So I called and I talked to them, and they said that you need to go to the emergency room or to an urgent care and get an EKG because it might be cardiac related. So I went to the urgent care. It's just only like 3 minutes down the road from me. And they're like, oh, I don't think it's cardiac related because you've been waiting now for like 20 minutes. But they did the EKG and they did some blood work. EKG perfectly fine, blood work perfectly fine, except for I have an elevated white blood cell count, which I've had since the week before I went into surgery. And all the times that I was in the hospital, it was high all that time. So the doctor diagnosed me with having gastritis, elevated acid production in the stomach, which, could be a sign of a healing stomach, or it could be a sign that I had eaten something that I shouldn't have. Not really sure about what caused it, but he prescribed me prescription Prilosec versus over-the-counter, it's just an acid-reducing medicine. So I took that. And I still continued to have pains and everything. And so I called my surgeon again, and they're like, well, I wasn't feeling good, and I was very nauseated, having dry heaves and things. So I called my surgeon, and they're like, well, the medicine was supposed to be taken by itself, and best thing first thing in the morning, and you shouldn't take anything with it. And of course, I had taken other things with it because I was also constipated, because you may not know this about surgery, but you will get constipated very easily. In fact, I've read some things saying that you will only have a poo every 3 to 5 days. So I had been taking Benefiber, which I had asked my surgeon if that was okay, and he said yes, but then it turns out that Benefiber is fiber, and if you don't get enough water, it just binds things up and makes you more constipated. So, yeah, not a good choice. So I tried something else, some other medicine, which probably was counterindicated for me personally, and I probably shouldn't have just followed the urgent care recommendation. So I'm going to go see my physician today. Now, maybe I should go back to my surgeon. I'm really not sure at this point. My physician is like 10 minutes away, and as I keep saying, my surgeon's like an hour away, and he doesn't see patients on Monday and Tuesday because he does surgeries on Monday and Tuesday. So I'd have to wait till Wednesday. I mean, maybe I could go see a different doctor, but then I'd have to start over from the beginning of, what my problems are and everything like that, which I'll have to do with my physician, but she's known me for 5 years and knows my medical history and, pre-surgery, all the things that I had wrong with me. I'm going to try that, see how that goes, see if she has any ideas, and then move on from there. So on Friday, like I said, I went to the urgent care, and then I went back on a liquid diet for Friday and Saturday, Sunday, and then yesterday I went and I had solid foods for breakfast and dinner, and that was fine. But now I've been waking up like the last 3 nights with stabbing pain then on my other side. So I don't know what that is. It's a little annoying, and the reason I'm going to my physician is because I don't necessarily think that the gastritis is either the only diagnosis or it's diagnosing the symptoms and not the cause, and I would rather find out what the cause is. And there's a lot of things that it could be, with or without a sleeve surgery. It can be a few different things. So otherwise, doing really well. Lost some more weight, and feeling pretty good. A little tired this weekend, just because of the, waking up with pain. But doing all the things that I should be doing. This is what they say: if you have any problems that's different for you, call your surgeon, which is what I did, and then follow the surgeon's advice, which I did. And maybe I should call. And I talked to my surgeon's office, I think like 4 times on Friday, and they said I could call back over the weekend, even though it was a holiday weekend, and that they would, that the surgeon on call at all times and be able to answer my questions. So I think I'm doing everything that I can. Definitely haven't broken any of the rules about what I can eat and what I can't eat. And, I knew there would probably be complications, and I knew that I was sailing along pretty well without any complications. And most sleeve patients that I've heard about or read about have some complication at some point, whether it's the day of surgery, the week of surgery, the year of surgery. You get it. There's always something that's going to change, because like any surgery where you've altered your body, you've changed the way that you were designed, and the way that you were designed has been going on for thousands of years, and surgeries have only been happening for hundreds of years. I'm not really quite sure. But we've changed the way that we do things, and we just have to expect it. Not freak out about it. Just deal with it and move on from there. Worst case scenario, I feel, is that I would end up back in the hospital and having to have more things done to me. Best case scenario is that the medicine that I'm on now for heartburn, gastritis, whatever, is going to work. So, once again, if you have any questions or comments or anything like that, please post them, and I look forward to hearing from you really soon. Bye.